What if I told you that your so-called normal blood pressure could be quietly setting you up for a stroke, heart attack, kidney failure, or something far worse? Sadly, I've cared for many patients in my hospital who were told their numbers were acceptable and they were either too high or too low for their age and health. Today, you'll learn how to know if your blood pressure is truly right for you, and I'll share the simple strategy I use as a cardiologist to keep mine in a healthy range so I can stay active for my children and grandchildren. Is it 120/80? That's what most people believe. But what if that number is too low for you or too high? If you're over 60, over 70, maybe even over 80, the right target may not be what you think. Lowering your blood pressure too much can cause dizziness, lightheadedness, and falls. But not lowering it enough increases your risk of stroke, heart attack, and memory loss. So which is it? At the end of this video, I'll tell you my personal blood pressure target and why I chose it. Let's break this down. When I went to medical school many moons ago, we were taught something very different. There was a rule, 100 plus your age. If you were 70 years old, a systolic blood pressure of 170 was considered acceptable. If you were 80 years old, 180 didn't shock anyone. And we were even warned not to lower blood pressure too aggressively in older adults because it could be dangerous. Fast forward to today. Now 130/80 is considered high blood pressure. That's a massive shift from 170 to 120. Did the human body change? No. The science changed. So were we wrong before, or are we overcorrecting now? Because after 70, this isn't just about numbers, it's about your independence. And in 2015, there was a landmark trial that enrolled more than 9,000 adults over 50 and older, many in their 70s. And they look at two groups. The standard treatment, the goal was to bring systolic blood pressure less than 140, and the intensive treatment, systolic blood pressure less than 120. And guess what? The intensive group won. They had fewer heart attacks, fewer strokes, and lower mortality. The results were so strong that the trial was stopped early. And when researchers specifically look at people 75 and older, they actually had higher benefits. And then came another trial out of China. They enrolled more, 9,000 people. And here the target's a little bit different. The standard treatment was to obtain less than 150 systolic, and the aggressive treatment below 130. And again, the lower group had fewer heart attacks and fewer strokes. Different country, different population, same conclusion. Low blood pressure reduces your risks of heart attacks and strokes and heart failure and kidney failure, regardless of your age. And what about the brain? There was a study called the Sprint Mind, and they looked, the intensive group had lower risk of mild cognitive impairment and lower risk of dementia, although the dementia did not reach statistical significance. The study was terminated prematurely. So now we have evidence that lower blood pressure helps your heart, your brain, your kidneys, and improves your longevity. So why not push everybody to 120 or lower? Now we need to talk about something critical. Who was not in these trials? Who was excluded? And in fact, for instance, on the Sprint trial, people who had diabetes, people who had a prior stroke, people who had drops in blood pressure when they stood up, anybody in nursing home, very frail individuals were not included in this trial. And blood pressure was also measured in ideal research conditions, in a quiet room, automated devices, multiple readings, no talking. And as we know, that's not how most clinic measurements are done. And if you want to learn how to measure your blood pressure correctly, watch my video, 10 Deadly Mistakes Measuring Your Blood Pressure, Doctor Explains. I'll put a link above and the description below. And the typical participant in these trials was not a frail 85-year-old who gets dizzy when he stands up. But you kind of wonder, what is frailty? Am I frail or am I robust? Frailty is not about age. It's not about white hair or lack of it, like mine. Frailty means that your body doesn't bounce back the way it used to. If you have a minor illness, a simple fall becomes a major event. And here's the way to tell you at home. Can you climb a flight of stairs without stopping? If you fell at home, can you get up by yourself? And when you go out for a walk with your friends, can you keep up with them? And there are more scientific ways of looking at this. And how fast can you walk 15 feet? If it takes you more than 6-7 seconds, that suggests a slower gait speed, a strong predictor of frailty. And this changes everything regarding your blood pressure. Let's imagine a simple U-shaped curve. In one side, your blood pressure is too high. On the other side, it's too low. At both extremes, the risk increases. High blood pressure increases the risk of stroke, heart attacks, and heart failure. On the other hand, very low blood pressure, especially in frail older adults, has been associated with lightheadedness, fainting, and falls, and even kidney injury. So the safest place is not the lowest number possible. It's the lowest number you can safely tolerate. How do you find your ideal blood pressure? Step 1, are you robust or frail? Number 2, do you get dizzy when you stand up? Number 3, have you had any falls in the last 6 to 12 months? And number 4, what is your overall health? A strong 70-year-old male may benefit from reaching 120/80 or even less. On the other hand, 82-year-old frail who gets dizzy when he gets up may be better off in 130s or even 140s. So we are not treating numbers, we are treating you. So after all of this, what is my ideal blood pressure? In 2014, I faced the biggest challenge of my life. I was found to have severe blockage in the arteries in my heart, and I went to triple bypass surgery. As a cardiologist, that humbles you. I had spent my entire life studying heart disease and had not protected myself. That was my wake-up call. My weight was 175 pounds, and after surgery, I made a decision: no more excuses. I adopted initially a plant-based diet, subsequently changed to a pesco-vegetarian diet. I exercised regularly, and I lost 20% of my body weight. And over time, my blood pressure changed. For years, has been below 120/80, and this year has been around 110/58 with a pulse of 50. And I feel fine. I don't feel dizzy, I don't feel lightheaded, and I'm not prone to falls. So that number works for me because my body tolerates it. But hear me out. I'm not telling you this should be your goal. If those numbers makes you dizzy, lightheaded, it's obviously too low for you. Talk to your doctor, and him and you will decide what's the best target for you, keeping your risk of cardiovascular events as low as possible, but at the same time maintaining your independence. And if you want to learn more how to lower blood pressure naturally without medication, watch this video, 7 natural ways to lower your blood pressure naturally. I'll put a link above and on the description below. And remember, your health, you must preach to the set, take control. See you next video.